Hello, everyone. Today on Get Fit, Stay Fit, Never Too Late, we're blessed to be joined by Dr. Mimi Zieman. Okay, let's shift gears a little bit, and you touched on it a little bit, contraception. Why don't you talk to us a little bit about the importance of contraception, not only domestically, but worldwide?
Yeah, so contraception gives women and men, but especially women, control over their fertility, autonomy over making life decisions when they want to be pregnant. Worldwide, contraception saves a lot of lives, especially in low resource settings where it's not either easy to get obstetric care. Many more women die in childbirth, and contraception is a cornerstone to saving women's lives. Even here in the U.S., where now many women can't access abortion, contraception can prevent pregnancies that can put their lives at risk, which is especially women with certain medical conditions. So contraception has much lower risk to a woman's body than carrying a pregnancy to term. So it's often going to, give her options for health and survival.
The goal of the podcast is to provide a platform where members of the medical community and the healthcare community in general can interact with the general public in an environment that is outside of the doctor's office and the hospital. Our podcasts will focus on what are the preventive measures that the general public can take in order to give themselves an opportunity to live a longer, healthier, and the best quality of life that is possible. We will also focus on informing the general public on how to identify warning signs and what to do when we recognize the warning signs. Early determination of illnesses provides the best opportunity for recovery and may require less costly medical procedures. A healthier public is in the best interest of everyone. People will live longer and better quality of life. The pocketbooks of the patients and the medical insurance providers should also see a reduction in expenditures. Healthier people generally require less costly medical procedures. Get fit, stay fit, never too late. God bless.
Welcome to Get Fit, Stay Fit, Never Too Late. Today we're fortunate enough and blessed enough to be joined by Dr. Mimi Zieman. Dr. Mimi Zieman is a physician, explorer, and author who has treated frozen limbs on the highest mountain, delivered triplets near the deepest ocean trench, danced through Broadway studios, and has written an award-winning memoir, Tap Dancing on Everest, about the risks we take to become our truest selves. Selected as Best Memoir of 2024 by the American Writing Awards, and for which she was named 2025 Georgia Author of the Year. Her story connects being a daughter of immigrants raised in New York City with discovering a passion for mountains. She backpacked alone in Nepal at 22, then served as a sole medical support and was the only woman on a remote Everest climb in Tibet when she was a 25-year-old medical student. Full of self-doubt, Zieman grappled with whether to go, but couldn't resist the call of the wilderness and mountains. She refers to that responsibility for a climb that she used no oxygen or Sherpa support and had no chance for rescue, her Everest. She's also written a play, The Post-Row Monologues, that has been performed in multiple cities, and co-authored 17 editions of a medical guide, Managing Contraception. Her writing has appeared in USA Today, Newsweek, Salon, The Sun Magazine, Miss Magazine, The Forward, NBC Newsthink, and other publications. She did her OBGYN training at Columbia University, a fellowship in family planning at UCSF, and is an advocate for reproductive rights, having served as a director of family planning, Emory University School of Medicine, chief medical officer, Planned Parenthood Southeast, and as an advisor to the CDC working on contraceptive guidelines. Her newsletter, Medicine, Mountains, and More, is available on Substack and provides medical news along with inspiration from art and nature. Welcome, Mimi Zieman. Dr. Mimi Zieman, welcome. How are you today?
Thank you. That was a long intro. I feel like I could have sent you a much shorter one.
But you know what? No, yeah, you achieved it. So if you took the time to achieve it, we're going to read it. There's no question about it. And it's
Well,
very impressive. And congratulations on all your accomplishments.
thank you.
You're
It's
welcome.
great to be with you. I love the theme of your podcast and what you stand for.
Oh,
So,
thank you very, very much. It's very kind of you. And we'll jump right in because I know you're busy and I'm not going to keep you all day. So we'll just jump right into our agenda. Why don't you tell us? Let's talk a little bit about general wellness and prevention. What screenings would you recommend for women, girls, i.e., PAP, mammogram, HPV, STI, and vaccines do you recommend? And how often and when, at what ages should they start? Just in general, what would your guidance be?
yeah, no, that's a great question because screening is meant to find out any health issues you have that you may not know because they tend to be silent, right? And sort of preventive. We know when you get into vaccines, preventing disease that is preventable.
Hmm.
I don't know that I could cover all of those things because that could take us hours, but I will say, um, from a GYN perspective, young women should see a GYN or a primary care provider who has the skills to do GYN, starting at around age 21, somewhere between 21 and 25, because at that age, it's important to screen for sexually transmitted infections. It is recommended that all women that age who are sexually active are screened for chlamydia, for example.
Hmm.
Chlamydia is a sexually transmitted infection that's very prevalent and in women is often silent, but can lead to things like chronic pelvic pain and infertility. So we definitely want to do that test.
Hmm.
And at that age, we want to start cervical cancer screening,
Hmm.
which we used to call PEP tests.
Hmm.
But now, more commonly, what we do is an HPV test because human papillomavirus is the cause of most cervical cancers.
Hmm.
So you will either get an HPV test starting at that age around every 5 years, a pap test, which looks at the cells. We call it cytology testing every 3 years.
Hmm.
Um, so that's important. Along those lines, we offer the HPV vaccine to younger girls and women. Ideally, you want to get that before someone starts to be sexually active because we are exposed to HPV through sex.
Hmm.
And HPV causes cervical cancer. So we want to get that vaccine, started anytime between ages 9 and 14. And
Hmm.
so pediatricians usually administer that. And that has prevented a lot of cervical cancers.
Good.
Um, you know, just getting your blood pressure checked is considered a screening test.
Hmm.
So during that exam, they're going to look for a lot of other things like starting your lifelong knowledge of what your cholesterol values are,
Hmm.
or whether you're at risk for diabetes and all those other things.
What do
Now
you
we
thought?
get,
I'm sorry. Just what are your thoughts?
no, go ahead.
What are your thoughts on mammograms? I know that's a
Yes.
huge topic.
So mammogram, again, we're going to start based on your individual risk. So doctors will do a risk assessment based on your health status and your family history of breast cancer to decide exactly when to screen. For the average risk person, most guidelines recommend starting at age 40
Mhm.
and then getting a mammogram about every 1 to 2 years, uh, you know, until about 75. But again, it'll depend on your history, and it's important to assess family history in that situation. And, then similarly, actually, colon cancer screening. Remember, it used to be everybody started at 50. That's now at 45.
45. Yeah.
So that's important to know too.
And what are we looking for when we do mammograms, just in general, without going into too much detail because we don't have a couple of hours to go. But what are they looking for in general?
Really, we're looking for breast cancer. So the flip side of getting a mammogram and part of the controversy about when to start is you will find other things that are not cancer that will lead to biopsies and testing that people then will say, well, that was unnecessary because it was benign.
Hmm. Hmm.
And so what we really want to find is the cancers, and that's why you'll find some controversy about exactly when to start screening because basically cancers increase with age.
Hmm.
So you definitely want to be getting them, after 50. Most people will agree yearly. Again, there's some controversy every 1 year or 2 years, but you can work that out with your gynecologist or primary care provider, how often.
Is there anything that a woman can do at home to kind of self-test a little bit to see if anything is going awry between screenings, or is it just stick with the screenings?
The consensus now, which will surprise many people, is sticking with the screenings because we were all raised to do a monthly test.
Yes.
Turns out that didn't really lead to picking up more cancers. However, that doesn't mean women don't find their own cancers. They do, but not during the monthly test. Suddenly they're in the shower and they say, oh, something feels funny. I didn't notice that. If you feel a new lump, go to the doctor right away. Um, but we don't really recommend monthly
Hmm. Hmm.
self-exam anymore. You can do them, but really if you find something different, something feels different, you're often right and you need to go to the doctor and check that out.
Understood. Understood. We're going to shift gears a little bit and talk a little bit about fertility. Uh, Women of childbearing age, or what can they do to prepare for pregnancy and to improve their fertility? What are just general recommendations that a woman can use to prepare herself?
So, there's a mental preparation. So what we're trained to do is to ask people, do you ever want to have children? If it's a young woman, do you know how many you might want to have or when you might want to have them? So it is a good idea to think about those things because if you don't want to have them, we can offer birth control if you don't want to have them right now, right?
Hmm.
Because you don't want to be surprised by an unplanned pregnancy. So it's called a reproductive life plan.
Hmm.
It's just thinking about when you want to have them and when you do want to have them, then being in optimal health, as you say. So, for example, young women should all be getting folic acid daily because if you have proper folic acid in your body, the risk of neural tube defects, a certain kind of fetal anomaly, is much lower.
Hmm.
And then, so what if you're thinking, okay, now is the time I want to have a baby, it's a good time to go and check in and have a discussion with your doctor. I'm ready. How is my weight? Um, am I at risk for diabetes in pregnancy? What are my genetic risk factors? Am I going to want to get a genetic test of the fetus once so all of that can be discussed in advance to optimize things. And it's important for women to know the period, a monthly period, is a sign of health if you're not on hormonal birth control. So your body is telling you, okay, everything's working fine and may work fine when you want to try to get pregnant. If you're not having regular periods, you should also go in and be checked by a doctor to see why that is. Is there a hormonal imbalance or some other reason? Again, to make sure your body is working healthy. Now, I just want to say if you are on hormonal birth control, like the pill or hormonal IUDs or patches or rings, then you do not need a monthly period.
Hmm.
Many of those methods can be used to eliminate periods, and that's not going to put your body at any risks because, yeah. So you kind of have to understand those two different conditions, the normal body and the sign of fertility by a monthly period,
Uh-huh.
and that it's okay to suppress that.
Oh, it is.
Yes, by hormonal birth control, because basically the hormones make your uterine lining very thin, so it doesn't need to be flushed. There's no buildup. and it's not making you, let's say, have a risk of cancer or infection or anything like that.
And what should as a young married couple who decides to have children, have gone to the doctor, done the best practices that you just recommend, they're, talk to us a little bit about ovulating and intercourse during ovulation periods.
Yes, so you ovulate mid-cycle, so it is a good idea for young women also, or people who want to get pregnant or just staying on top of their health to keep track of their periods. So the first day of bleeding is called the first day of your menstrual period, and just writing that down in your calendar so you keep track of your periods and how often they come. And so if you do that, then mid-cycle, which is 2 weeks later, is when you are going to get pregnant if you have sex. So
I see.
that's yeah.
So it's important
So
for
that's good.
women to keep a track, so to speak, of when it
Yeah.
starts, and 2 weeks later is probably the best time, the most important time,
Most fertile time.
most fertile time. Yeah, yeah,
Yes.
yeah. Got it.
If you're younger than 35, you can take a year to get pregnant, and that's considered normal. If you're over than 35, your fertility declines,
Hmm.
and it gets a little harder to get pregnant. So it's generally recommended after 6 months of trying with no pregnancy to check in with a doctor.
I see. I see. Okay, let's shift gears a little bit, and you touched on it a little bit, contraception. Why don't you talk to us a little bit about the importance of contraception, not only domestically, but worldwide?
Yeah, so contraception gives women and men, but especially women, control over their fertility, autonomy over making life decisions when they want to be pregnant. Um, Worldwide, contraception saves a lot of lives, especially in low resource settings, where it's not either easy to get obstetric care. Um, Many more women die in childbirth, and contraception is a cornerstone to saving women's lives.
Hmm.
Even here in the US, where now many women can't access abortion, um, contraception can prevent pregnancies that can put their lives at risk, which is especially women with certain medical conditions.
Hmm.
So, contraception has much lower risk to a woman's body than carrying a pregnancy to term. So, it's often going to, give her options for health and survival. So it is important to plan what contraceptive method works for you and to be in conversation with a physician if you have side effects to change those methods out.
That's exactly where I was going to ask next. How would a young woman determine what type of contraception should be used, or should the male be the one with the contraception? And you you said, well, you hit the key right there, right there. So you're
Well, you know, for we call it dual method use. Sometimes a woman is using a birth control method and the man is using a condom, and that is specifically important to prevent infections. Male condoms are the best way to prevent sexually transmitted infections. So it's not often the most reliable method of preventing pregnancy
Mhm.
because sometimes it's not used even when intended.
Right.
So it's often used as a dual method. Once a family or couple has decided they don't want any more children, a male vasectomy is the safest, best, and most effective option for that family.
I see. I
But
see.
those are really the two male methods we have available now. For a woman choosing her method, it's very individual what her main goals are. For example, if she wants to avoid pregnancy at all costs, she wants to look at the most effective methods, which are IUDs and implants.
Mhm.
Um, and if she knows she never wants to have children, then a female sterilization too, tying
Understood.
your tubes or removing your tubes.
Understood. I know that's gonna be helpful to a lot of people. Let's move on to the menopause. What is menopause? You hear a lot about, but what is it from a clinical standpoint?
So menopause is defined as when a woman has no more periods, she's finished her reproductive phase of life, and it's defined retrospectively. It's once a woman has had no periods for a full year. She is in menopause at that time. In the US, that average age is about 51 and a half. Before that time, she may experience irregular periods,
Mm-hmm.
and a lot of the symptoms that people are really talking about much more now with each other and on social media, such as hot sweats, brain fog, sleeplessness, irritability, and that can start in the perimenopausal period, which can be several years, even as much as 10 years, but more typically, let's say 3, 4, 5 years before actual menopause.
Okay. And what are some of these symptoms that women may feel while going through menopause?
Yeah, they may feel moody. They may have trouble sleeping. They may be irritable, um, just feeling off balance, and they may have hot flashes, and they may have this brain fog, which is hard to describe. So, for example, in some of those situations, if a woman is healthy and non-smoking and has no other risk factors, they might want to go on a birth control because a birth control has estrogen and progesterone and can kind of flatten the moods and give the hormones that are fluctuating in a steadier state. And there are a lot of things that can be done. I think women are rightfully upset that a lot of these things have not been addressed proactively in the past.
Mm-hmm.
And so now, there's a flood of books and podcasts and topics on the subject, and people are getting a lot more information and help.
Got it. Got it. And what are the health risks that postmenopause may pose to women?
Yeah, well, the longer we're in postmenopause, we start to look more like men. So the estrogen that we've had, and the longer we continue on estrogen, even in the menopausal years, if we decide to take menopausal therapy, estrogen is kind of protective on a lot of the cardiac issues, right?
Mm-hmm.
Um, so eventually, the longer we are without that, we sort of get more at risk of heart disease
Mm-hmm.
and metabolic diseases. So, you know, the other issue is that even if a woman doesn't feel comfortable taking hormone therapy by patches or gels or pills, most women will benefit from some vaginal estrogen therapy. There aren't many contraindications for that, and that will help with symptoms such as urinary symptoms after menopause, urinary tract infections, vaginal dryness, which can make sex uncomfortable, um, and pain even. So that's something to discuss with your doctor.
Understood. And how does diet and exercise and stress affect the reproductive health?
Well, see, I am in line with you in this sense. I feel that, you know, we should all pay attention to diet and exercise throughout the lifespan, whether you're 20 or 80. And the more active we are, the healthier we are, the more better quality of life we have.
Mm-hmm.
So I think, you know, anything we can do to stay active and keep moving is essential.
Mm-hmm.
So for example, you mentioned I have a newsletter.
Yes.
Um, for January, it's free, and for January, I only do it once a month. For January, I highlighted exercise because so many of us in January now, which is we're recording in January,
Mm-hmm.
we want to be healthier
Yeah.
and we want to be more active. And the studies on exercise, I covered one study which looked at a lot of data showing that exercise is as good as antidepressants or talk therapy
Mm-hmm.
for depressed mood
Mm-hmm.
and is considered a first-line treatment. It's now been shown in many studies exercise helps with our cognitive decline as we age. So more in my age bracket and older, um, and even in patients with dementia.
Mm-hmm.
And some interesting study I looked at that showed that variety of exercise can be important for longevity. So, you might love just doing spin class and never do anything else, but it's good to walk every once in a while, lift weights. Resistance training is so important, as you know.
Hmm.
So mixing it up can help
Well,
too.
that's good. And I'm glad the viewer and audience is hearing it from a medical professional because they hear it from me every week. Yeah. And they see me
And
every
it's
week.
great.
Yeah. So I'm glad that you took a few minutes to touch on the importance of exercise. And I know you come from an exercise background. You've danced through Broadway studios, I'm told. Why don't you tell the viewers a little bit about that love of yours, dancing through Broadway studios? Tell us a little bit about that.
Yeah, so I grew up in New York City, and I think it was ninth grade. We went on an outing to see a chorus line, and I was hooked. I was like, I want to do that. And I followed my dance teacher. I was like, "Where do you train?" And I made it down to Broadway and I took classes with the Broadway dancers, and that's all I wanted to do. I danced every day and I wanted to be a Broadway dancer. And my mother thought that was the most ridiculous thing any child of an immigrant could want to do. I would never support myself. And she convinced me, to do something a little more steady,
Yeah, yeah.
like medical school. But I never stopped loving dance. And in fact, today, right before recording with you, I went back for a tap class for the first time in a couple of years because I was nursing a knee injury.
Hmm.
And I just said, I got to see if I can still do it. I got to get back. And it went pretty well. So we'll
Good,
see.
good,
But
good,
I love it,
good.
because that's the other thing with exercise. You got to find something you actually enjoy,
Joy. Yeah.
then you'll continue doing it.
Yeah, there's no question about it. And you're so right. Not only physically, but mentally. When I
Yeah.
walk, you know, I'm connecting with nature. I'm not thinking because I'm a businessman. I'm always thinking business here. What's the next deal? What's the next move? There's always something in my mind. But when I walk, I realize that I start to notice different things that I overlook most of the time. And I'm communing with nature. And when I'm done with the walk, what might have been on the front of my mind before I started to walk. It's like, I don't know where that is anymore. I just enjoyed a nice walk. I don't
Yeah.
worry about it. I don't stress about it. So it does have a nice mental impact. But go ahead.
But you're bringing up something really important, which is when you go on that walk to not be listening to the radio or podcasts or music and actually allow for that silence and for looking at the nature, because that's been shown to be really important for your mental health. So, not to constantly be stimulated,
Hmm.
but to have that walk and be able to do what you just described.
Yes, yes. Well, I'm living proof of it. I find it, and I recommend that for everyone, and particularly business people, but not only business people, because business people are under a lot of stress. And I think that if you get out and just get some exercising in, you stop thinking about this deal, that deal. You're thinking about the weight that you're pushing up. You're thinking about the birds that you're seeing when you're walking, and it just changes your whole mental outlook. So I'm glad that you are echoing this as a medical professional, and I hope that it'll hit
100.
home with people. But let's move on a little bit. I'm interested in our next topic, next two topics. I'm going to read a quote here. Your remote Everest climb. Oh, I want to hear about this. The team attempts a new route up the east face without the use of supplemental oxygen surface support or chance of rescue. When three climbers disappeared during their summit attempt, Zieman reaches the knife edge of her limits and digs deeply to fight for the climbers' lives and to find her voice. Why don't you tell us a little bit about what inspired you to climb Mount Everest and go on this journey? And then tell us about the journey.
Sure. Um, so when I was in college, I was introduced to mountains for the first time in Colorado in the Rockies. I was doing some field biology and I fell in love with
Hmm.
the mountains.
Hmm.
That led me to hike alone in Nepal. And that led me to then be invited on this Everest expedition. And they invited me as the doctor. The
Mhm.
problem was I was still in medical school in the Bronx of New York,
Mhm.
and my 3rd year of medical school. And I was like, would I really be able to do that? Go to the wilderness with no chance for rescue, taking care of this climbing team. Um, and I basically decided this is a once in a lifetime opportunity
Mhm.
and I'm not going to miss it.
Mhm.
So I studied hard. I got time off from medical school. This was 1988.
Mhm.
And I went. And so it was a completely different era. It's different than what you see today. You see Everest and the long lines and people guided up the mountain.
Mhm.
So back then, they didn't have that. It was the best climbers in the world on an expedition. In this case, only 4 climbers, tiny team,
Mhm.
and they were gonna in the east face of Everest is a very remote place in Tibet. It had only been climbed once before our team. And they were purists. They wanted to climb it on their own. They wanted to see if they could find a new way up. They didn't want to use oxygen. We had no Sherpas. So they were trying something never done before. And so I wrote my book, right? It came out in 24, this many decades later, because I thought this was such an unusual thing to be a part of.
Mhm.
I had to stretch out of my comfort zone.
Mhm.
I had to do something really hard. Um, and to me, taking advantage of those kind of opportunities to stretch yourself, to face your fear. And why did I do it? Because I wanted to be in the place that makes me the happiest, the
Mhm.
mountains.
Mhm.
And I knew, and I was there for 4 months. I knew I would get to be there in that beautiful nature for 4 months. Like, when else would I get to do that?
Mhm.
So that's why I did it. And, and then we had this incredible experience. They are in the history books. It's called the 1988 Kangshung Face Expedition
Mhm.
because they did something so extreme. And, like most adventures, we had trauma
Mhm.
and I had to take care of them.
Mhm.
And, that's why what you were saying in the introduction, I call that my Everest, being the doctor when I was just a student and doing my best for these climbers. And so I grew enormously from that. And I just feel that that's an interesting message for other people to know that they can do things they don't know that they can do,
Yes, yes.
but they're willing to
You had to
try.
try,
They're willing
right.
to try.
Get out of your comfort zone and
Yeah,
follow your spirit. You may not have any experience at it, but there's something pushing you to do it. You have an urge. Don't be afraid if somebody tells you you can't do it. But how did you prepare
exactly.
for it? How did you prepare? Physically, mentally? Because that's not something you do every day.
Yes. So I did prepare physically. I rode my bike, I jogged, I lifted weights, and I put a backpack on and went up and down the stairs of my high-rise building,
Mhm.
backpack with 40 pounds, and did a lot of stairs.
Mhm.
So that's how I prepared physically. Remember, I was in medical school. So I also went to the library and read everything available on high altitude medicine and physiology and nutrition,
Mhm.
because I was in charge of the nutrition too.
Mhm.
And I had met someone when I was hiking in Nepal who was serving as a doctor at a high altitude clinic. So he was my mentor in terms of preparing the entire medical supplies of what we would need up there and for how long.
Mhm.
So I had to do that preparation too.
Gotcha, gotcha. So how was your bodies affected at the higher you went at each level? How did your body react?
So everyone reacts differently to altitude. And part of why I was invited was because I had met these climbers in Nepal and I had been hiking for months and I was very strong and I did well at altitude.
Mhm.
So that's why they took a chance on me. They said, well, we could get a great doctor and then they're going to be terrible at high altitude.
Mhm. Mhm.
I said, well, you could probably find both, but okay, I want to go. So, um, um, we did well with the altitude. Because we had a lot of problems. We encountered terrible snowstorms, and it took us a long, long time to get to the east face. Whenever you can go very slowly in
Mhm.
your altitude progression, the better you're gonna do.
Gotcha. Gotcha.
Now, we were living close to 18,000 feet, so we felt it. We were tired. You don't sleep well at that altitude. And the guys on the climb, the higher they went, they would react each time they went to more extreme altitude.
Understood.
One guy got altitude sick once he reached above 24,000 feet. He got very, very sick and had to come down.
Oh, okay. Okay. But he did make it down, though. Well, that's good. And then, so tell us a little bit about your award-winning memoir, Tap Dancing on Everest. That book that's right behind you there. Yeah,
Yes.
tell us a little bit about the book, what inspired the writing, and just a little bit about what it's about.
So what inspired it is what we've been talking about, that feeling I had looking around me, like what makes certain people take risks and other people not. And I wanted to really probe that and investigate that and look at myself in that process. What ended up happening is I ended up in talking about my family history too. I'm the daughter of Holocaust survivors. Um, my family were immigrants. My grandmother was she had to leave Berlin when Hitler came to power because she was Jewish. And my father was the only survivor in his whole family from Latvia. His parents and siblings were killed, and they literally came on the boat. And so I grew up in this family um, that had a certain perspective on life. And they were very like strong, bold people. And that influenced me. And I never in my wildest dreams wanted to write about any of that. But what's interesting about the writing process is you have to kind of give into that. You surrender to what story is coming out of you.
Mm-hmm.
And somehow I wanted to connect that background to how I ended up in Nepal and then Tibet. And so it's truly a coming of age memoir of this young city girl. My parents were divorced when I was young too, who had to find her own way.
Mm-hmm.
And part of that calling was being in the mountains. And part of that was all the stuff I took from them, good stuff and bad stuff, including my Judaism. I hosted a Passover Seder in base camp, and the stuff where I had to, separate from them and find out who I was separate from them. So it's a story about that. It's much more of a coming of age story than an actual expedition,
Mm-hmm.
but it's framed around our Everest expedition.
Well, that's good. That's good. And how do you feel after getting your thoughts on paper and for everyone to read? How do you feel about what you've put out there?
I feel exposed. Prior to this, I was a pretty private person.
Mm-hmm.
So
Mm-hmm.
people are a bit shocked about how I put everything out there.
Mm-hmm.
Um, and that's part of but that's part of being brave in a different way,
Yeah.
and if I'm talking about facing fears and having courage, I had to do that.
Yes, there's no question about that. And I know that the book has been well received, and it'll continue to be well received. And I don't want to take you too much more of your time. Looking at the time, and we've kind of ran a little bit over. It was a pleasure talking with you, and I want to say thank you for coming and joining us on behalf of myself and the viewers that will see this over the coming months. I want to say thank you for taking the time out of your busy schedule to join us, and keep up the good work. Uh, we'll follow you on Substat, look out for your monthly newsletter, and we'll keep an eye on you. And please come back and join us in the future.
Thank you, Paul. It was an absolute pleasure.
God bless you, and we'll see you next time. Thank you, Dr. Mimi Zieman. I hope everyone enjoyed the wealth of information that Dr. Zieman shared with us. On behalf of everyone, I just want to tell her thanks for taking a few minutes to stop by and give us some tips to stay healthy and arm us with knowledge that we need to stay healthy. We wish her well with her book and her future endeavors, and hopefully she'll come back and join us again with some more knowledge to share with us. But just wanted to reinforce what I always say, that exercise is completely important mentally and physically for our well-being and to give ourselves a chance to live a healthier life. And, from the doctors, they'll tell you, athletes will tell you, and, you don't have to do anything too strenuous. Walking is good, just moving the body is good, and we'll feel better. So just wanted to reinforce that. I hope you got something out of today's episode, and we'll see you on the next episode. Thank you and God bless you. Remember to get fit, stay fit, never too late. God bless.